Hello, everybody. My name is Taylor. I am on the Prevention, Education, and Awareness team at Friends of the Family.
Now go.
Okay. Hello, everybody. My name is Taylor Gleitz, and I'm on the Prevention, Education, and Awareness team at Denton County Friends of the Family. And I'm going to let Sarah introduce herself.
Hello, my name is Sarah Morley. I'm also on the Prevention, Education, and Awareness team. And I want to thank you all for joining us today as we discuss the effect of COVID-19 on children with disabilities. Before we begin, I want to introduce our three panelists who have agreed to be here today. So first we have Nathan Richardson. After growing up in the Houston area, Nathan Richardson graduated from the University of North Texas with a bachelor's degree in applied behavioral analysis. He worked for several years within the Denton County Friends of the Family Community Education Department, providing presentations and workshops to school-age children, university students, and local organizations regarding healthy relationships, domestic violence, and sexual assault. Nathan then went into public education as a special education teacher for Denton ISD. He's passionate about community education, equality or equity within education, and community anti-violence work. Our next panelist is Jose Tapia Fusile. He is currently a fourth-year doctoral student in counseling at the University of North Texas. Jose has 10 years of experience serving clients with disabilities in a variety of settings. Currently, Jose serves clients across the lifespan with a focus on disability populations in 3 languages: English, Spanish, and American Sign Language. He has published in the International Journal for Play Therapy in working with deaf children using child-centered play therapy. Lastly, he has also conducted child-parent relationship therapy groups focused on children with disabilities. And finally, we have Anita Montana. Anita Montana is a licensed professional counselor at DCFOF that currently serves children and families affected by domestic violence and sexual abuse in both English and Spanish. Anita has experience working alongside children with disabilities and developmental delays and their families that range from in-home to clinic settings. She has trained service providers in evidence-based interventions to assist with in-home learning for parents of children with autism, and has developed curriculum to help support parents in their critical roles as their child's first teacher. So I want to welcome each and every one of you, both our panelists and our viewers, for joining us today.
We want to start this webinar first by taking a moment of silence to remember the lives of George Floyd, Breonna Taylor, and Ahmaud Arbery. We appreciate you in honoring those who have lost their lives recently, and we'll take about 20 seconds. Thank you for joining us in that moment of silence. Okay, our first question for the panel. So how has the stay-at-home order affected children with disabilities? Who'd like to go first?
Oh yeah, I'll go. I think it's affected everyone. It's taken a toll on everyone, and you know, our normal looks a certain way, just like kids, you know, with special needs and disabilities looks a certain way. So it's just taken a toll on us, but in different ways. And I think children with disabilities just face additional challenges because cognitively, emotionally, developmentally, they process differently. You know, they learn differently, and especially differently than most people that they're surrounded by. So it might have been harder for them to just understand why they can't go to school, why they can't see their teachers, why they can't play with others, and just the immediacy of the adjustment period, you know, was night and day. that they had to do this. That just naturally can be more stressful for them.
Yeah, and I think too, like, it's hard just thinking about how the ways in which they make sense of the experience and how they're understanding what's going on, and also who's telling them what's going on and how are they describing it. I think, the system itself, the family system, becomes so stressed with this experience because now the parents become the teachers. They have to do things maybe in ways that they never had to before. So I think, it creates a lot of disorganization and anxiety. And depending on the child, how old they are chronologically, but also developmentally, that all goes into kind of how they are impacted individually.
Yeah, I have talked with some of my colleagues at that I worked with at Providence Elementary, and a lot of them saw parents having to become frontline workers essentially. So where before they had somebody coming in and working with their family on a daily basis, now that person isn't there because they're not considered an essential worker. But really for them, they are, for those families, they typically are essential workers. Those teachers of students with disabilities, they are these kids caretakers for, those 40 hours a week that they're at school. And then suddenly they don't have that. And the parent, an already stressed family that has to take care of somebody with differing needs, is going to be even more stressed because now they have to provide that care that was being provided before. That's one of the biggest things that I've seen. So the what was being done to help can't and isn't being done. And of course that disruption has ripple effects throughout, right? We as typically developing people might have all of this stress. It was, as Anita said, it was stressful for all of us, right? And it's even more so to be out of routine for people who can't understand or, may understand it in a different way.
Yeah, so Nathan, thank you for bringing that up. Could you talk a little bit more about what services were the schools providing to children with disabilities that when they closed were unable to provide to them any longer? What was missing? What became lost?
So the biggest difference between the care while school was in session versus not was obviously the physical presence of the teachers with them. Speech pathologists might have a little bit easier time doing their therapy session over a Zoom meeting, but a physical therapist or an adaptive PE teacher might not have that same ability. A lot of times, so what we did was we proposed how services would be changed. The school districts are all required to provide individual education plans for students with identified disabilities. And we are held by law to implement that. And because there was a disruption in that delivery of services, we had to come up with a new plan for how we were going to provide the students access to the general ed curriculum, along with the support for the goals that they were trying to meet for their IEP. And like I said, for some, that was, it was easier than others, right? I had some students that really they were needing a check-in with the teacher to make sure that they were turning stuff in. Others of my students, it was more where I was having to meet with them and going through the curriculum and making sure that they understand what's being asked, and pretty much doing the same thing that I was doing before, running small groups, but just doing it over Zoom. But those services that required like an in-person care, those were the things that couldn't be implemented. And a lot of times that's what, those were the services that kind of fell through the cracks, I guess. There wasn't enough time to figure out how to provide that service in a way that was, safe and healthy for everyone involved. Because if a caretaker, as much as a family might need a caretaker or a teacher to come in, if that person is also going to other students' houses, then they might become a vector for infection and things like that. That was one of the biggest challenges, I think.
Anyone else have anything to add to that?
I think just going along kind of the disruption in the home in terms of who has access to come into the home and who's one, not only the families feel comfortable with, but from the employment standpoint, the providers are, what are their restrictions and were they told, you're not allowed to, or, it's complicated. And for families who really depend on those types of services to maintain the health and integrity of their child, that what happens after that's gone or temporarily suspended. I think it was something that Nathan was mentioning was there was no time everyone was rushing to create a plan and properly figure out ways to serve children in education and also in other settings, but also for parents who are they might be frontline workers themselves, or maybe they've lost their job. There's just so many layers to this experience for children. And, given what we've seen recently with increased cases of abuse in hospitals and whatnot, it's a scary time for kiddos with disabilities who might not have the support that they need on a daily basis that they were used to.
Yeah, and all of you have briefly touched on this in some capacity, but how important is routine, or how important is socialization to children with disabilities? Now that everything is changing so quickly all the time and new things are coming up, how important is that routine and socialization?
So important. And part of that is because when we think about I've worked with many families who when they go see a medical provider because their child has been diagnosed with some form of disability, they say, okay, here's the plan, here's what we need to do to medically intervene, right? They come from this medical model, we need to fix what's quote unquote broken. So parents are inundated with that information, and they're not always provided the information of how can your child be successful and hold that disability identity and also feel quote unquote normal or typical as others. So, for me, I think about how do parents communicate with their kids? How do the parents view disability themselves? And how that just all, I think in my role, for me, the parents are going to be, during this time, the parents have been who I've worked the hardest in ensuring that they understand different ways that they can reach their child developmentally, that it makes sense and it's not complicated. But again, how many people are having that information? And I got confused. I sidetracked myself with what you asked, so I apologize. The socialization, sorry. Yes. So because of that, and the system's level of stress, so there might be less patience, less flexibility to take a moment and sit and engage with their child. Rightfully so, with everything going on, they might not have the opportunity if it's a one-parent household or caregiver household, or there's multiple children that they have to care for. Those things might not be available. And then also too, I think about, because of the restrictions, and also something Nathan mentioned earlier when we were just talking, was the socioeconomic status of the family. Do they even have access to internet to be able to connect with maybe another fellow student or a family member, a cousin? How are we ensuring that they have some form of socialization or engagement?
Yeah, the one of the biggest things I had talked about earlier, the biggest shifts that's happened within education and really all areas around disability has been from isolation into integration, and trying to integrate and really studying and looking at, and then because of the research validating how important it is for not just peers, but same age peers. A lot of times, even if a student might not be at the same academic level as their peers, their same age peers, they might get promoted to the next grade because that socialization and that emotional connection and the if they are taken out of that setting or held back, then that's going to further that's going to create a further gap between them and who and a general ed peer or a typically developing child. And so this, in addition to so that layer of complexity, in addition to COVID, is just going to widen the gap.
Yeah, I think, like this is piggybacking off of what you said, Nathan, but socialization just plays such a huge role in learning about the world, about other people, about themselves, in a general population. And so for kiddos that do, have disabilities, they're also using socialization to learn about that in different ways, and also develop, skills that they need to thrive, like communication, how to express themselves, and being able to have an environment where they can see other people do it. Social emotional development, all that stuff. And so isolation really has limited their opportunity to be able to observe and participate in this social setting. And so which causes setbacks, the feeling of loneliness or feeling even more different. If that was a thing before, I'm sure is a bigger thing now.
Okay, so what can parents do for their children during this time? What community resources might be available, or how can they help their child get that sense of normalcy or socialize when that's their primary place of getting that at school is now gone?
I meant to actually add this part, the parent part, that is so important, because the isolation aspect of all of this has isolated parents. The support that they may have had before is no longer. Parent support within other parents that experience similar challenges within their family, that's hard to access now. And so there are a lot of community resources, not just for kiddos, for parents, because parents also are kind of an equal part of this puzzle, right? Like, we need the parents to be able to support the kids. And they're just as important as being able to provide support for these children. And so, there's lots of different resources in the community for different ages, specifically different disabilities or identified disabilities. I know younger children, there's early childhood intervention, and I know that they've had to adjust the way that they provide services, just like everybody else has, but that they're not gone. They're still there. I know in Denton, Loretta House, I'm going to shout out to them. They're doing a parent support education stuff over virtual learning. And then, for academic age kids, there's I'm going to give kudos to Nathan and all the people in the district, because they push so many efforts to drop what they were doing and completely change it to make sure they are still providing these things. Whether it's different, it's still there. And so I think the resources is just a matter of reaching out and not being afraid to do that too.
Yeah, I think the best places to look for as far as support will be those community connections. Hopefully, if a parent had access to a community beforehand, it'll make it easier to have those connections now. If they don't have one now and are looking for it in the midst of this, that's going to be a little bit harder. But any social worker worth their salt is going to know how to get parents connected, is going to know what's going on in our community, whether that's Denton County or wherever. And so those caseworkers at Friends of the Family are a great example. They can get them connected to other services, counselors, psychologists, psychiatrists, doctors even, are often very aware of what's going on in the community and where parents can find help.
And something that I think that will be happening, not now, it'll be offered this fall. In Denton at the University of North Texas, there's 2 counseling clinics on campus that are community-based clinics, the Child Family Resource Clinic and the Counseling and Human Development Center. They'll be offering child-parent relationship therapy services via Zoom or through some online platform. So I know that could be a resource for parents who might want to, that's structured time that they get to learn specific skills so that they can have time with their children. I think one thing for me that just sticks out is it really is important for any type of professional really is working with parents is to normalize this stressful experience and to validate this like heaviness that they might feel because there's so much pressure now. And again, because when we talk about children with disabilities, they might carry other identities, maybe being a child of color, a person of color and also having a disability. So all these things that are happening right now in our society, how are parents able to not only help themselves, but to help their child and talk about this in such an open way? Because it's just a hard time for parents. And so some of the things that are available, like everyone mentioned, those are definitely great resources. There's a lot of Facebook groups that are I'm a part of a few for caregivers and things like that. And they're very active and they're being much more intentional with doing virtual meetups, like using Google chat, the video platform they provide, or Facebook Messenger type of video to try to engage with people, with parents and caregivers during this time. Because many of them, like we've mentioned, are experiencing a lot of changes that they're trying to navigate.
So we've talked a little about the effects on children and the effects on parents. So besides parents, what can community members do to best support those with disabilities or best support parents who have children with disabilities? What can we as the public do to help make sure that they are getting their needs met? What kind of special considerations can we make to help them through this difficult time?
I think for me, what comes up is an understanding that parents are I have an extra layer of fear around going in public, taking their child out in public if they have an immunosuppressed system, or if the child just has maybe a severe disability, that they just are too fearful of leaving the home, having people come over, or while they're in public, really working to maintain their social distancing. So I think providers just need to know, to have some level empathy, I'm always going to use that, towards the situation, because it is adding extra layers of anxiety that families may not have had before.
Yeah, I would say getting involved as far as, donating to local food banks, I think is a really, really important thing right now. There's a lot of families with children with disabilities that are food insecure. And so increasing and doing whatever we can to help increase that food security will be really, really beneficial. Being part of a community garden, right? Donating, all of those things both of those things can be really helpful to that end. I think those are 2 really good things that just come to my mind.
Yeah, I think kids with disabilities, often have additional health complications, which is so scary right now because we're just in all of this together. But these families do have additional worries and concerns, like Joey said, because it's too scary to go outside. It's too scary to take my kid anywhere. And I think a community that's open to just being aware about that and aware and learning about someone else that's different than them is always just a stronger community, and just trying to educate ourselves is just so powerful because we're a community, right? We help each other. And that any additional consideration to somebody that's different than us, a family with a kiddo with special needs, that's always so appreciated. Any help, like it doesn't matter, away from far away, just shows more empathy, like Joey said, and precautions that I see you, I'm aware, and I'm here, even though I can't be there for you, I'm here from maybe afar, because people that are in general population, we don't know what that walk and what that journey is. And no one can ever walk in the same shoes as somebody else, right? It's just impossible, but we can absolutely walk alongside them. And as a community, that's kind of what we're looking for.
And I want to add to that really quick, because I think, you know, something related to food insecurities and other types of concerns for families, maybe financially not having the ability, but also just the fear of leaving, is if you do know someone who has a child with a disability and you know that their maybe health is easily compromised, maybe you check in to see if the family needs like a drop off of food or a drop off of some kind of medicine or some supplies or things that can keep the family from having a family member from stepping outside, having multiple forms of interaction with people, and then coming back and potentially, someone getting sick or whatnot. But having someone do drop off or just check in and see what's needed, I think could be very helpful and meaningful.
Yeah, doing that individual work. If you know someone who is needing or even potentially might need help, just asking, being humble and saying like, hey, I'm not 100% sure what you're going through, but know that I'm here for you. If you need me to watch your kid while you go on a run or take a 5-hour nap or whatever it needs to be, doing that individual work can also be really, really, really impactful.
Thank you. Y'all make a great point, which is that this is a scary, uncertain time, and kids pick up on that. So how should parents or their caregivers be talking to children about the COVID-19 situation?
I think it's going to, it's really hard to give a blanket, everyone should do this, because there's such a wide range of, when we talk about disability, we're talking about, everything from autism spectrum disorder to, emotional trauma to hearing impairment. There's a whole constellation, and each one of those different communities is going to require a different type of intervention, for lack of a better word. And so each of those children with disabilities is going to be unique. And so they're going to be able to understand and cope with information in a different way. Additionally, another layer of complexity could be if parents have a differing ability, that can also make explaining things harder. And so those are the considerations that have to be weighed. What can the person understand? What are they? How can we give them a sense of control, a way that they can have stability in their life in spite of these things that are changing? Maintaining a routine. I don't know that I could ever say that. We can never say that enough. Maintaining a routine is so important. Just for everyone's mental health. And so, yeah, I think those are things that need to be held while we have that discussion.
Parents are, I think, always are going to be their expert on their children. And so it is going to take, getting creative and getting pretty honest, but in a way that parents are naturally going to know their kid will be able to process or understand, because that's I think the only way we can make a very certain or a very direct way of approaching a kid about this is through the perspective of the parent. They're going to know how their kid is going to take this information and what it's going to take in the explanation process for them to be able to understand. I think that routine point is something that helps kids feel safe. They know what's going to happen, right? And so with COVID, and this is just an example that's coming into my head, washing our hands, that's part of our new routine now, right? And that eventually will feel comfortable, eventually will feel predictable and safe. And that can be part of this honest conversation too. And that, there's so many different ways, but that's just one that came to my head.
And I think a few things come to mind. The first being children can pick up on their caregivers, like either stress or anxiety or frustration, anger, all of those things. But the part that becomes challenging is if the parent doesn't directly say, I'm stressed because of what's happening, or I'm stressed because I just, work is, I'm not sure what's happening with work, or, in ways that make sense to the child. But with silence, if the caregiver or parent goes silent and they're dealing with all that stress and anxiety, the child may interpret that and internalize that as it's me. I'm creating stress on them, or they don't want to be around me, or, in ways that just become problematic with, the attachment between them. So really knowing that it's okay to be transparent and say, I'm stressed today, work, in ways that just are very simple. And, I always tell parents less than 10 words, when you're trying to, depending on the developmental age of the child, maybe it can help. Some things that come to mind for parents, there's a lot of things that are coming out through the American Counseling Association of how to talk to children about COVID, not specifically towards children with disabilities, but children in general. The Association for Play Therapy also put something out. But I always think, like, if people are interested, I always say, YouTube it, do a YouTube. How do I tell my child about COVID? And see what makes sense. If there's a cartoon about it or something that's developmentally either appropriate, that can go a long way too. So same with when we talk about resources, there's so many resources to help kind of develop a narrative of how to communicate this to children. One thing that I helped parents do through child-parent relationship therapy is structured doll play. And that is a helpful tool for parents to use toys and words to help create a story and, show them, kind of help them make meaning of what's going on in a way that meets their needs. So yeah, that's one way. But also I would recommend YouTube or Googling it and just seeing what's being put out there with good resources. Not, there's some bad ones out there. But.
Yeah, I want to reiterate what India said with that parents are going to be the experts on their child. And also what Joey said, that kids and people in general will pick up on all of our nonverbal cues. So even if we're saying everything's fine, and the house is burning down around you, right? Kids are going to know that the house is burning down. Don't try and, be dishonest with them. Be genuine and understand that you're communicating more. And, for individuals that might be nonverbal, that's the primary way that you are going to communicate with them is through your nonverbal and through your presence and what that is and how you are with them. Those are things that need to be remembered.
And something that came to mind related to, what parents can do in the home. I know something that has been helpful for some, it comes from a Montessori practice, but having like a relaxation station. So having a space that has like maybe some headphones with like calming music, something that they can hold on to, something that can soothe them. And I often share with parents, especially during this time, is model that. If you're feeling stressed, go to the relaxation station, show them that that's where you can go when you're feeling overwhelmed by everything. So that can be a helpful way too. I think we never want to discredit or discount the feelings of children and what they're experiencing, and through that we want to make sure parents are able to, feel like they can express some of that in a healthy way with their child and not say, everything's fine when clearly it's not. So yeah.
Yeah, those are all excellent points. I was thinking with what Anita said earlier, that parents are often kind of the child's first teacher. And during these times when we're in quarantine, they might be that person's only kind of interaction. And if parents are maybe not being honest or maybe not being transparent, that might communicate a lot to the child about how people are supposed to act with each other. So given that y'all are professionals in this field, can y'all speak a little bit individually about how have you seen children be affected by COVID-19? What are your work experiences like during this time? If we can start with Anita, that'd be great.
Sure, yeah. there's just so much confusion. I think maybe that's for me, that's been the biggest thing. Like, why are things happening in this way, and why can't we just go back, or why are people not doing the things that I thought we're supposed to? You know, that there's confusion, there's fear, there's anxiety, um, nervousness about just going outside, or being able to go to the park even. What if somebody was here that had COVID? Like, you know, there's so many things in kids' heads. And because they are naturally, with a child, their brain is structured differently than ours because they haven't developed yet, right? So that's a natural thing that they're gonna try and figure out themselves. And so that's why I think the point of just being very honest and genuine about the things that are happening in the world right now is so important, because if we don't, they're just gonna stick into whatever they make sense in their heads. And kids with disabilities and the wide range of abilities that they have, they're going to do the same in their own way. And so, but I think for me, that's the biggest thing that I've noticed with kiddos with specific developmental delays, and kids that don't have developmental delays that I work with. They're all experiencing very similar things, which I think speaks a lot to the community aspect of all this. Like, nobody should ever feel like we're doing this alone. And so, because we're not, but they might feel like it, kids might feel like they're doing this alone. And so the support of the family and just, you know, being together in this time is I think the biggest thing. And if there's additional supports that are available, you know, like us, we want to be a part of that team so that they don't feel like they're alone too.
I think so. What I've experienced similar is, you know, just confusion and more questions. And something that is hard is if we get into the position of, well, am I responsible for, you know, telling them what's going on? What are the parents? So I think one thing that has been helpful for me is when all this started happening and we started transitioning to telehealth, and depending on the child's age, just focusing more on parent strategies and ways to support them through this time is really being intentional with the parents and telling them, lean into curiosity when your child is asking questions. Try and, you know, hear them out, because one thing we always try to understand. One thing we always try to work towards is understand what the child is experiencing. So helping the parents kind of make sense of, how's my child thinking about all of this? What have they come up with in their minds and, you know, imagination, and what ways can they maybe correct some of that and provide them different information? So yeah, that's been probably the thing I faced the most. And what's been hard from clinical for play therapy for me is we stopped play therapy after they started doing stay-at-home orders, and we went straight to focusing on parents only. Philosophically, our campus, our program didn't feel it was appropriate to provide play-based interventions to children using telehealth. There are many providers that do, so know that is just one way that people are managing it. People are also providing it. It's just ways that we see it. So yeah, that's been challenging on many ends, especially for children who built very strong relationships with the therapist. So one of the ways that I've worked to help just ease that process of, you know, not coming is I've sent little cards, you know, just letting them know I'm thinking of them, I'm here, you know, this process is, you know, hopefully we'll get back to the playroom, but it's still sending some form of tangible contact that they can have.
Yeah, for my students, they were transitioning from elementary into middle school. And so a lot of them weren't, you know, they had been going to this school for so many years, and then they were moving on to something else. There was a lot of, you know, planned celebrations and, you know, end of year parties, and like, you know, we ended up doing a reverse parade, which was really, really wonderful. And it was really uplifting for me because I got to see these kids like in person, even though it was like 40 feet away and they were in a car, you know, but it was still really special. But even after that, one of my students ended up calling me, and I was talking with her, and she asked me, so Mr. Richardson, is school over now? And, that I felt like was a perfect encapsulation of what my kids' responses were to this whole thing is like, what's going on? Like, I don't really understand. And it was only in that moment that she was able to say, like, are we done now? And I was able to say, like, yes, you're on summer break. Have a great summer. Have fun in middle school. And it was nice that I got to be that for her. But it was also hard because, it's just, I know that she's not the only one of my students that had that same question. But she's the only one that I got to say that to. I think that's been how I've seen my kids, is just like everyone else has said, confusion and an apprehension about what this is.
So going forward, what special considerations might be made or maybe already exist in the community or in the school systems to better help or accommodate children with disabilities, maybe over the summer or going into the next school year?
I guess I'll address this a little bit. So the bar for getting school support over the summer was changed a lot because of what was going on. So a lot of students that, we made the summer school look different for a lot of students, including students with disabilities. It's a really, and right now, from what I understand, school districts are still trying to figure out what the fall is going to look like. There are any number of ways that school could open back up. It could be, everything opens up and it's back to normal. It could be they don't open up at all, or it could be, most of the other situations are somewhere in between where, some kids come to school on an A day and then the other half of the kids come on a B day, or, it's just, we don't know what it's going to look like. On top of the fact that we have all of those services that we were supposed to implement over the course of the spring that we weren't able to do, right? Like the physical therapy, the adaptive PE, all of those physical helping things that we were going, services that we were providing. And so the answer is we're working on it. Is sort of how it is right now. Those decisions are being made, and I encourage anyone who's interested and invested, which should be most everyone, get involved and make sure you're paying attention at the school board meetings, and make sure that those meetings are accessible to everyone. That's what we can do as typically developing people, is to make sure, Joe, before at the beginning, Joey had talked about making sure that there were transcripts of this webinar, making sure there's transcripts for those school board meetings, making sure that those voices are being heard in those places where decisions are being made. That's what I think that's the next step moving forward in making sure that the community, and specifically, my perspective is in the education, that schools are doing what they need to be doing for students with differing abilities.
I think what comes up it's one thing that I've seen and have not seen, is some organizations or places around when I was in DFW last week, before I moved over here, there was some places were very transparent about, hey, these are the restrictions we're putting in place, this is the plan. And then others weren't, they hadn't had a plan yet. They were still formulating something. And I think, again, silence to me is never the answer when it comes to these types of situations, because parents who have kids with disabilities if they're dealing with extra fears or anxiety related to, is my child even going to go back to school? Do I trust that they can go back to school? And that they'll be safe and all of those things. it's hard, it's scary. It's like, they're still trying to figure that out, navigate that. And then also the education system, as Nathan mentioned, figuring out a plan. So I think being transparent is probably going to be everyone's best bet in terms of this is what we're doing, or this is what we're still trying to work on, so that people can feel at ease, or at least have some more information to make a best informed decision. But I think for parents, because they've already experienced, modified education in the home, what worked, what didn't, and how can you best prepare if you're not going to have your child return to school for, health concerns or reasons. How can you, what worked that you can continue, and what didn't work that you can modify and maybe implement different strategies or tools. And I definitely think having open and constant communication with the teacher is going to be the best bet to ensure that the parents are successful in helping maintain the education for the child.
Okay, so we got a couple of questions from the chat that I'm just going to pivot to. So some people have a question about, one person says, I'm concerned about the potential spike in child abuse in children with disabilities. Can you speak to this and suggest ways that the community can be supportive? Or how can somebody who suspects that a child is being abused by a caretaker, how can they safely approach that topic?
I guess I can start. That's a hard question. And part of that is because people are remaining inside their home, social distancing, it's going to be less obvious, and you might not even be aware that it's happening because you're not seeing them like you would if they were. It's different than if the kids were in school. Teachers might pick up on it, or other people might pick up on, something may be going on. But if they're home the entire time with a few contacts from outside people, I think that becomes a challenge. I think maybe for me, what things that come up is for families that are in contact with each other, aunts, uncles, cousins, those types of things. If you know that a child has a disability in your family system, maybe just being more mindful and knowing that these things can occur at a higher rate for them. So I can see from a reporting standpoint, maybe it's becoming more from families. And I say that only because of current restrictions and whatnot, and who feels comfortable communicating and whatnot. But that's a hard question to answer. I don't know if I have a good answer for that.
It is a super hard question, and it's a hard reality to face and to know that that's a thing. That's a truth. That's facts, right? Like in this time, and it's hard to be able to address and to even know what to say. That can be scary. Am I somebody that needs to say something, or is this not my business? I think that might be one of the things that I would encourage people to not consider in a doubtful situation. And if there is a doubt for a reason, it's there for a reason, and I would encourage people to trust that. Because these kids are a more vulnerable population to this abuse, especially with this isolation aspect there. They don't have their teachers as advocates additionally, like they typically do, or their therapists, or their occupational, therapists, or PT, any of those people that they typically engage with. They're not around anymore, or they're around, but in different ways, right? And through Zoom. And so it's just a very different dynamic. And so for community members that are aware of kids in their neighborhood, maybe that have disabilities or developmental delays, to just open your eyes a little bit and to just be that eye for your neighborhood. If this is something that you feel is calling to you, because unfortunately, this is a bystander effect that we talk about here all the time of, should I say something? I didn't really like that, but it's not my job to do anything about it. I think in this specific time, sticking with something like that could be very dangerous to a kid.
Yeah, I totally agree. I think that if there's any sort of doubt, then or when I say doubt, if there's any feeling that something is wrong or something is off, report it. And being honest, nothing might come of the report, right? It might be that it just goes into a file cabinet and just sits there. But it's better to have that there than to not have anything at all. Additionally, we know that the statistics say that individuals with disabilities, especially children, are more likely to experience abuse than their typically developing peers. And then now that typically developing peers are at a higher risk for abuse and neglect because of the COVID crisis, that goes up even more exponentially. And so we all need to be looking out for everyone and having the courage to stand up and say that this isn't okay. And even if they're not my family, it is my business, because that's not the world that I want to live in. And standing up and calling that out.
And I think too, if you're a community provider who is providing services during this crisis, specifically to children or families, I think it's important to contact your hospital. Contact the hospital, find ways to get in contact with the trauma unit that deals with these sensitive cases. They have specialized medical professionals that get additional years of training for dealing with abuse, that can be a line of contact and a resource. So if a family comes in, hey, they can send them to you all, and you can, kind of intervene at that point. So yeah, I would recommend that.
Can you all talk about what some of the signs of a child in general, or a child with disabilities, is being abused?
I think just behavioral observations are one of the biggest signs, or a very clear sign, at least, not biggest sign, but a clear sign. If they're typically happy-go-lucky and all of a sudden, they're reserved, or they're more shy than their typical personality, that's something that you can see. I know with this, isolation factor, that's hard. Because you're not always around other people, especially if they're not in your family. This could be an observation from far away. And so that's hard. But if you are around people, kids with disabilities that you do interact with, that would be one of the biggest things, if they just seem like they're not themselves.
Yeah, I would add for specifically with children with disabilities, if there's any evidence of regression without them getting back right. So let's say they were potty trained and now they're not, and nothing that you're doing is helping them get back to that where they were before. That's a really big thing. Or if they have been working a long time and to increase their verbal vocabulary, and suddenly they're back to 1 to 2 words. That's a really big red flag. So that thinking about that regression of all this progress I've made, if they suddenly revert back, that's a really big red flag. For me, that's one of the first things that I would notice. And that would be really important. Now, again, COVID's going to be hard. It's going to make that more complicated, right? Because, if their therapist isn't seeing them regularly, if they haven't been receiving the same services, then there might be some regression there. So it's gonna be messy, and it's going to be gray no matter what. And so you're just gonna have to go with your gut, I think.
I would agree with what everyone has shared. From a behavioral standpoint too, whether it can be polar opposites. So someone who's very withdrawn, so maybe they weren't, and also someone who's very dysregulated, when maybe they weren't. Maybe they had more emotional regulation control than they do currently. But all of those things kind of play a role. And again, it's hard too, because you're dealing with, depending on how the child has made sense of this experience, and being at home, and all of the things that they don't have access to anymore, that can also impact them. So I wish it was as easy as like, here's a clear list of identifiers. These are a few, but in terms of with this added layer of crisis, it becomes more complicated.
So if somebody suspects that a child is being abused, whether that child has disabilities or not, who should they contact or who should they report to?
So Department of Family and Protective Services is the state agency that addresses that right there. That's CPS. That's who I report to as a teacher. Couple of things to note. A lot of times as a double, to make sure all your bases are covered, it's a good idea to make an online report and then also to call it in. What that does a lot of times, if you just do one or the other, all of the information might not be there. The person who answers the phone call might ask more clarifying questions, but they also might editorialize what you're saying. So they might make judgments or, add or leave things out based on what they're hearing and their experiences. And then on the other side, the online report typically doesn't get the same, doesn't have the same urgency as a phone response or a phone report. And so a lot of times if you want to get stuff done, the squeakiest wheel gets the grease, right? Can't hear you, Taylor.
Sorry about that. I clicked it, but didn't do it hard enough, I guess. So we just have about 3 minutes left. Do you have any, oh, hang on, we had a question come in, 1 second. So is there a place to see free ways to connect for kids over the summer? So Tracy says we have our free autism spectrum disorder meetup going on Zoom. It meets the third Friday of every month. So do y'all know of other like ways to find resources like that in the community?
I think it just depends on what community you live in and where you're at. Denton, Dallas, Metroplex counties have different things, and so getting in touch with obviously your school district would be a good one because they're really resourceful. But your local mental health agency, because it's not just mental health, they also have services for disabilities and developmental delays. And they have their own department for that. And I think that would be a good resource. I know the Texas Health and Human Services, they have some online too that are specific to specific disabilities.
I know like the Independent Living Center, REACH, they might have resources for summer programs that are going on. It really depends a lot of, because again, with everything changing, there's a lot of people working to either modify the programs that they originally set or canceling them altogether. So I think just making phone calls, emails, and checking in. So I know a lot of families are part of like specific groups where maybe it's parents of children with Down syndrome or whatnot. They might be promoting a lot of program content over the summer. That might be something to look into as well.
Yeah, the only one that I would add would be to look at your local municipal Parks and Rec department. A lot of times they will have sensory experiences. So like they might have a day where they turn on all the lights in the gym and they have a bunch of bright and flashing lights. But like with no noise. And they might have something on the opposite side where there's a lot of noise but no flashing lights, right? So that would be another place that I would recommend. I know that Denton Parks and Rec Department has been meeting over the last year to try and increase their level of accessibility at their parks. And so checking out their website, but I'm certain that most other municipalities have some sort of adaptive or accessible movement options, and that would be a good place to look.
Okay, we are just out of time. I want to thank you all so much for joining us, as well as our panelists, Anita, Joey, and Nathan, as well as our viewers. Thank you so much for spending this past hour with us. We hope you have a very relaxing and enjoyable day. As kind of said earlier, we're going to be getting a transcript of this out. So if anybody was unable to watch it or unable to hear, we'll be making sure that we get a written transcript out to those who need it.